on Ann Arbor's 1071 and the Cure in there with pictures of you. We are rocking for the hungry right here in front of Kroger on South Maple. I'm Kelly Brown along with Tony Denton, who is the Senior Vice President and Chief Operating Officer from University of Michigan Health. Hello and good afternoon, Tony Denton.
Good afternoon. It's great to be here.
It's good to have you here. Are you all dressed up for the occasion here today, or are you coming from work?
I am coming from work, and it's just part of what I do.
Yeah. Well, you must be a busy person, so thank you for taking the time.
My pleasure.
Please tell us about your role at Michigan Medicine and your role with food gatherers.
I'm the Senior Vice President and Chief Operating Officer for U of M Health, which is the patient care enterprise of Michigan Medicine Academic Medical Center. So I'm responsible for operations for the enterprise, inpatient and outpatient, and am very actively engaged in community service in terms of community health, environmental sustainability, equity, social responsibility, and impact.
And with food gatherers?
And with food gatherers, I'm a member of the board,
Mm-hmm.
but actually my time with food gatherers goes way back in terms of our family commitment to trying to feed the hungry and the homeless, going back about a decade. And so we've
Wow.
been engaged in personal fundraising campaigns for food gatherers. And in addition to my work as COO, sponsoring drives through Michigan Medicine over the last few years, with emphasis on the last 3 years or
Mhm.
so tied to the pandemic.
Once you're with them, they get you.
Oh, it's a passion,
Yeah.
and it's so needed
Yeah.
for us to have champions for the
Yeah.
cause.
Definitely. And they are champions with
Yeah,
every single thing that they do, and they do a lot
yeah,
with help, of
yeah,
course.
yeah.
I said that every single time I open the microphone, there's diesel involved. Could you talk a little bit about the connection between health and hunger?
They are directly connected. Um, we look at um, hunger or food insecurity as a important social determinant of health.
Mhm.
Without healthy food and nutrition, people are subject to illness and disease, which leads to adverse health impact, which then leads to family challenges in terms of how to take care of family. Certainly, the cost of food impacts families' abilities to feed their family in a way that keeps them healthy. So um, it's actually a tragedy that we have to have food drives in order to feed people, given the abundance of food in our society.
Mm-hmm.
But because there are those issues, we do know that without food, without healthy food, can lead to illness, can lead to injury, could lead to disease, which then leads to the need for health care, which I think is unnecessary, and then it then leads to costly health care.
Mm-hmm.
So to be able to close that gap, we think is really important to keep children healthy, the ability to learn,
Mm-hmm.
to keep families healthy, ability to work, and it just takes one of those burdens off of families that is a tragedy if we aren't able to solve it.
And they work so hard at getting healthy food over at food gatherers in so many different ways. When they work with Kroger and they work with all their partners, and
Yes, food gatherers is a lifesaver,
yeah.
and so partnering with over 170 different local organizations is really important because we need collaboration to be a part of the solution. Not one organization can do it alone. Food gatherers is a convener
Mm-hmm.
to continue to raise awareness about the cause, the importance of the compassion for people, the community, friends, neighbors, strangers,
Mm-hmm.
in a way that we know that we can make a difference if we work together because we are the power of we as opposed to the power of one.
Right, exactly. I have one more question for you. Can you share how Michigan Medicine has chosen to partner with food gatherers?
Yes, I mentioned earlier sponsoring many food drives, which includes creating awareness across our entire organization about the issues related to um, food insecurity, the lack of access to healthy food. So, since the pandemic, we've held 5 drives in partnership with food gatherers, and 313,000 or so meals have been the result of those drives. In the last 2 months, I announced a million meal mission for
Mhm.
Michigan medicine, which is, corollary to what Food Gatherers is trying to gather in this drive,
Mhm.
so that we can continue to raise the important understanding that we are of the community, and so that means working with the community in order to feed the community in need, to provide a hand. And in our framing and working with food gatherers, the whole idea is to build bridges and to connect communities.
Right.
And so we have to work together in order to accomplish that
Right.
when we have a shared mission.
And they do. They know who to ask and who to call and who to work with, and that's what our mission is here today, is to gather 1 million meals. So we're rocking for the hungry, and thank you for being here today.
Well, I'm just so grateful for you and what you all are doing on our
Thank
behalf.
you. We're freezing for a reason. It's Tony Denton, Senior Vice President and Chief Operating Officer at University of Michigan Health. Thank you so much for being here and taking the time. I know you're a busy man.
Oh, thank you, and go blue.
Oh, yeah, go blue. We'll be right back with Matt Nathanson next on 1071.